Hello all, this is Dr. Alsup, and in this learning objective video, we will be exploring the meninges with an emphasis on the spinal meninges. So, as mentioned, the primary focus will be on the meninges, but there are a few meningeal specializations that we want to touch on in addition, importantly, to the spaces that these meninges will create. Now, there are three membranous layers that surround the central nervous system, aka the brain and the spinal cord. And so we're going to discuss these from superficial to deep. So the most superficial is going to be the dura mater, which is the most robust. Dura mater literally means tough mother, so very visible. There are two layers of dura around the brain, so within the cranium, as you can see here. So here's one layer here, here's one layer here. You can have blood that's running between these when we're talking about within and around the brain. But there's only one dural layer associated with the spinal cord. The arachnoid mater is intermediate and closely adhered to the dura mater, but separated from the pia mater. So here's from the dura mater here, but it's separated from the pia mater by these trabeculae, these spider web-like trabeculae here. That's actually where arachnoid gets its name. So you can see a real space between the arachnoid mater and the pia mater. And then the deepest and most intimately related to the CNS, or the brain and the spinal cord, is the pia mater, and this is this delicate transparent covering. So if you see that the brain and the spinal cord appear shiny, it's because of the pia mater. All right, so let's start with the dura mater in terms of specializations, and there's two that I want to discuss. The first is going to be the dural sac. So the dural sac actually extends from the foramen magnum, so right at the bottom of the skull, all the way down to approximately S2, or the second sacral vertebral level. All right, so you can see kind of where it ends right here. And S2 is actually well past where the spinal cord actually ends, which is about at the L2 level, at the conus medullaris. So you see the spinal cord ends well before the dural sac ends. And this is because the dura still needs to be around to surround the cauda equina, or these lumbar and sacral nerve roots, which extend from the end of the spinal cord in order to get to the correct level. So supposedly the cauda equina resembles a horse's tail. That's where it gets its name. It is in this region between the conus medullaris and the end of the dural sac that a lumbar puncture will occur. And we'll talk about this in more detail in another learning objective, but really entering this region, so this region around here between the end of the spinal cord and the dural sac, will allow avoidance of the spinal cord. So the needle will avoid the spinal cord, and that needle will actually cause those roots to move away. And this will allow an extraction of CSF for diagnostic purposes, such as in suspected meningitis. Typically, the needle is entered between the spinous process of L4 and L5, or between L4 and L5 at the supracristal plane. So kind of that the top of the iliac crest. If you put your hands on your hips, you're resting your hands on your iliac crest, and it's there that you are going to feel pretty safe that you're entering somewhere around this region. All right, another specialization of dura mater is the filum terminale externum. You'll often see this referred to as the coccygeal ligament. This is visible from the end of the dural sac. So here's that end of the dural sac to the coccyx. So I'm going to kind of trace right next to it. It will actually envelop the filum terminale internum, which is a pia mater specialization from the end tip of the spinal cord. And this filum terminale externum is going to play an anchoring role for the spinal cord and meninges. So anchoring is very important. You'll see in other specializations as well. And here's that filum terminale internum. So this was the externum. Externum is dura mater. The internum is going to be a specialization of the pia mater. And it's actually going to be fairly easy to distinguish from the cauda equina root. So here is the end of the spinal cord, and you can see extending from the end of the spinal cord down to the tip of the kind of the end of the dural sac is going to be that filum terminale internum. It will appear whiter than the surrounding cauda equina, and it will be enveloped by the filum terminale externum at the end of the dural sac, and they'll travel together. So again, anchoring is key here. The last PIA specialization I want to discuss are these supracool denticulate ligaments, which are extensions of the PIA from the lateral portion of the spinal cord to attach to the dura or the dural sac, and this will be located between the dorsal and the ventral rootlets and roots of the spinal nerve. So you can see that kind of these extending here. And there aren't denticulate ligaments at every spinal cord level, but there are many, so generally around 20 to 22. And similar to those filum terminale, the denticulate ligaments are playing an anchoring role, so keeping that spinal cord from moving too much within the dura. Now let's talk spaces, real and actual. So what do I mean by that? What is a real space and what's an actual space? A real space is naturally occurring and it's often observable. So this is happening without pathology. A potential space means that it is not a naturally occurring space, as in the space does not typically occur unless, say, an infection enters the area or blood enters the area or air. So the typically non-existing space between the layers becomes an actual space. So let's start with the most superficial of spaces, which is the epidural space, so epidural, so upon the dura, which is located between bone and dura mater. All right. In the cranial region, the periosteal dura is closely adhered to the bone, and so this is going to be a potential space. You can have, say, blood enter the region with, like, say, an epidural hematoma, but that is not naturally occurring. But in the spinal region, this is an actual space. So there is space between the bone and the spinal dura mater, and this space is typically filled with epidural fat and lots of venous plexuses. So you can see that the bone's been removed in order to see the epidural space. So here's dura, and you can see all that yellow there. That's going to be the epidural fat. The subdural space is a potential space in both the cranial and spinal regions and is located between the dura and the arachnoid mater, which are typically very closely adhered to one another. So this is a potential space in both. And then last but certainly not least is the subarachnoid space. You see it referred to as the subarachnoid cavity here. Same thing. This is an awesome space because this is where cerebrospinal fluid or CSF flows, which surrounds and protects the CNS. This space is located between the arachnoid and the pia mater. And not only is it filled with CSF, but also vasculature, particularly in the cranial region. And of course, those trabeculae, those arachnoid trabeculae are going to be throughout in this region. So this is an actual space that exists during life. So that is it for the meninges. That was a lot of fun. And of course, I always like to end with the super awesome summary slide. Always, please feel free to reach out with any questions and have a great rest of your day.